Hi, Mrs. Morris. How are you?
Hi.
My name's Mitchell. I'm your vital signs tech.
And I'm Jen. I'm going to be your student nurse today. How are you doing?
Oh, not so great. I'm having trouble catching my breath.
Okay. Can you start off, tell me your name and date of birth, please?
My name is Marge Morris. My birthday is June 6, 1989.
Okay, good. All right. Is it okay if I call you Marge?
Sure.
Okay. I see that you're kind of laying flat in bed, so we're going to kind of get you elevated a little bit. Maybe that will help kind of breathe a little bit better.
Okay.
I'm gonna put on your O2 monitor on as well.
Okay.
And then that's just going to check your oxygen. Let's see what that's at. You're at an 87 right now, which is a little low than we like. I see there's a nasal cannula right next to you. Have you been wearing this today?
Oh, I went to the bathroom and I forgot to put it back on.
No problem. We'll get it on you right now.
Thank you.
You're welcome. And then we'll see if this is going to work. It worked a little bit. You're now up to 90, which is better. I'm just going to increase it up to 6. And then I'm going to start listening to your heart and lung sounds, okay?
Okay.
All right. And then Mitchell's going to get your vitals.
I'm gonna take your temperature. Go ahead and open up your mouth and lift up your tongue.
I'm going to listen under the gown just to make sure that I'm getting the most accurate reading, okay?
Okay.
All right.
98.5. Looks good.
And then just take a deeper breath than normal.
And take your blood pressure.
All right. And I'm just going to listen to your belly sounds now, okay?
Okay.
All right. Everything sounds good. I'm just going to feel your pulses both like on both sides. Good. I'm going to check your feet out. Feel your pulses down here. Good. All right. How are you feeling? Is it
A little bit better, I guess.
a little bit better? Okay. All right. So we're going to be back in about 5-10 minutes. I'm going to give you your call bell in case you need anything within that time. I've got right here. If you need us, just press that red bell. We'll come coming, okay?
Okay, great. Thank
All
you
right.
very much.
You're welcome. Thank you.
Thank you.
Okay, let's talk about how that went. First of all, what do you think went well?
I definitely feel like we addressed the respiratory problem first while we still got our head to toe assessment and everything like that. So I think we worked well together as a team and really like getting to our patients' needs.
Great. What do you feel like you both learned from this scenario?
Definitely always taking what the patient says first. If they're having problems like breathing or whatever, definitely like look into that because I mean she wasn't wearing her nasal cannula, she was laying flat, so addressing those problems first before you go ahead and assess the patient is definitely a priority.
Right. Anything else that you noticed?
I like the way that we were able to identify an issue right away, and to take away although you can still cross off everything that you have to do with our complete head to toe, as long as you prioritize and know that one issue is primarily the thing that you need to focus on at that moment.
Still working everything at the end.
I noticed you mentioned prioritization. What was this scenario about, and what was your priority action?
So the scenario was to go into your patient, get a head to toe assessment, but along with that, the patient was experiencing trouble breathing. So then that had the focused assessment. So making sure that you focused in on a particular part of the patient, but also getting your full head to toe along with it, so you're getting both sides.
Right, and I noticed that you attended to the respiratory status first.
Mhm.
And because it looks like you noticed that's what her primary problem was.
Yeah, we put the nasal cannula back on, we got her sitting up, and then we also increased her O2 to help her breathe a little bit
Okay,
more.
anything that you would do differently?
Looking back now, I definitely can remember that we didn't, at least I didn't check the posterior lungs.
Mhm.
So I know like patients can be heavy, but I could have always asked Mitch to help kind of
Sure.
lift her up a little bit so I could listen to her posterior
Right,
sounds.
why would it be important to check her posterior lung sounds?
Just to make sure that the patient doesn't have any like crackles or anything, or potentially getting pneumonia or anything like that. So just making sure that you're getting all the lobes back, like front and back, to
Right.
make sure the patient's okay.
Anything else about the simulation that's really not clear?
No, I feel like it was definitely a teaching moment where we can look back and see like what we did good and then what we like missed, one or two things.
Okay, great.